This morning, a killer remains on the loose after brazenly murdering Brian Thompson, the CEO of United Healthcare.
These are the latest images of the man New York police are looking for following the execution of 50-year-old Brian Thompson. Sutton says, interesting to him are the words scribbled on the recovered shell casings. The Associated Press reporting those words are deny, defend, depose.
The United States is considered a developed nation, but it's one of the only industrialized nations that doesn't have a system of universal health care. Along with that, there are many other notable flaws. What's wrong with the American healthcare system, and can it be fixed? Let's find out. The American healthcare system has changed a lot over the past century, shaped by economics, politics, and the needs of people. Back in the early 1900s, healthcare was mostly paid out of pocket, with doctors making house calls. But things started to shift during the Great Depression and World War II, when employer-sponsored health insurance became a common workplace benefit. Then in 1965, Medicare and Medicaid were created to provide coverage for seniors and low-income Americans. Fast forward to 2010, the Affordable Care Act aimed to make healthcare more accessible and affordable. Even with these changes, the system today is still a mix of public and private providers, with issues like high cost and unequal access that continue to spark debate. One would think that the United States government pays less than other industrialized nations towards healthcare due to it not being universal. But it's actually the opposite. The US spends between 15 and 20% of its total GDP on healthcare, equating to between $4 to $6 trillion. The two largest sectors of receiving these funds are Medicare, Part A and B, which include hospital care and outpatient services, respectively, and Medicaid. In 2022, Medicare represented about 21% of total national health spending, and Medicaid accounted for around 16%. But in 1997, Medicare Part C was created as part of the Balanced Budget Act of 1997. Medicare Part C, or Medicare Advantage as it's also known as, is a type of health plan offered by Medicare-approved private insurers. It allows senior citizens to pay a monthly premium for supposedly added services and benefits. But since its introduction nearly 30 years ago, governmental health spending has more than quadrupled to well over $4 trillion. This is due to how Medicare Part C works internally. For one, since it's associated with private corporate insurers, these companies often overcharge the federal government for healthcare services that would have been cheaper and more practical under Medicare Part A or B. Medicare Part C also has a higher rate of denials, with certain companies higher than others, due to the fact that policies associated with Part C are more restrictive than regular Medicare. And since Part C is handled by private insurance companies, it generally has a higher administrative cost, and a lot of that goes to the executives and profit margins. To the general population, healthcare is divided into types. Around 54% of the population gets their healthcare through employment-based private insurers. Medicaid, a healthcare coverage for poorer individuals, and Medicare both account for around 19% each of healthcare coverage, followed by direct purchase coverage at 10%, TRICARE at 2.4%, and VA healthcare at 1%. While there are many private health insurance companies, one provided the majority of it, United Healthcare. Nearly 53 million Americans are covered by United Healthcare, representing 15% of the population. The company has historically been known for overly denying claims of its customers, with its average denial rate being 32% for in-network claims, significantly higher than other health insurers such as Cigna, which only denies 7%. This means that at one time or another, 16 million Americans were denied by United Healthcare, with some of those being associated with individuals who needed an important operation or have a pre-existing condition. Animosity towards the health insurance industry has been building in recent decades due to rising overall healthcare costs, premiums, denials, and prioritizing profits over health. This hatred likely led to the December 4, 2024 assassination of United CEO Brian Thompson by Luigi Mangione in Midtown Manhattan. Obviously, doing something this dramatic is counterproductive, but it did send shockwaves that have generated discussion about the internalized corruption of the healthcare industry. The problems of the modern American healthcare system are extremely complicated. In 2010, the year Obamacare went into effect, there were nearly 49 million uninsured individuals. But during the 2010s, that number started to decrease dramatically due to previously uninsured people signing up for Obamacare. But many of them are underinsured. The bulk of the Obamacare policies are high deductible and out-of-pocket plans, with some plans having over $5,000 deductibles and similar out-of-pocket cost. While certain primary services may be covered under these plans, they are quite limited unless an individual exceeds their deductible and out-of-pocket cost. And even still, some plans after those are reached charge for things such as office visits and generic drugs. If someone wants better services, they have to purchase a plan with a higher monthly premium, and even some of those have limitations. Obamacare also sold out to try and lessen the increase in cost of healthcare and did and still does this through tax credits and subsidies. But since its introduction, monthly premiums have continued to rise. And for those not eligible for subsidies, costs have risen even more considerably. Another problem with American healthcare is its results. Despite all the money spent, demographic health statistics are behind nearly all other developed nations. The US's current life expectancy is 80.9 years old, ranking it 49th. Its infant mortality rate is 5.1 deaths per 1,000 live births, and its maternal mortality rate is 21 deaths per 100,000 live births. For a nation that spends massive amounts of money on healthcare, these statistics are subpar. One reason is that the US healthcare system is highly fragmented, with individuals receiving care from multiple providers without adequate coordination. This leads to inefficiencies and poorer outcomes. Another reason is that the US has one of the highest levels of income inequality among developed nations, which correlates with disparities in access to healthcare, nutrition, and housing. Then there are hospitals. There are non-profit hospitals, one that operate without the purpose of making money, and for-profit hospitals, one that operate with the purpose of making money. However, both types still do charge significantly higher prices for services than other developed countries. Take a look at this breakdown of just an overnight stay at a hospital for a urinary tract infection. The total bill was $18,275.98. That's a lot of money, and for someone who isn't insured or underinsured, it can break the wallet. With for-profit hospitals, ones who are owned by investors and shareholders, the prices are even higher, due to the fact that their first and foremost intention is to make as much money as possible. Another thorn in the American healthcare system are pharmaceuticals. In the developed world, the only two nations pharmaceutical companies are allowed to advertise in are the United States and New Zealand. If you watch network television, you'll notice that there are numerous drug commercials and shows such as popular morning shows that are sponsored by Big Pharma.
This weather report brought to you by Pfizer.
Today's countdown to the royal wedding is brought to you by Pfizer.
And now a CBS Sports Update brought to you by Pfizer.
Meet the Press data download brought to you by Pfizer.
By advertising and being sponsored by mass media, the American public will be influenced by this. Also, pharmaceutical prices in the United States are substantially higher than other developed nations. This is due to the fact that there is no government body to negotiate or cap prices for most medications. This free market approach allows companies to charge whatever the market will bear. For example, Wegovy, a drug used to treat type 2 diabetes and now obesity, costs $1,350 in the United States for a 28-day supply. In Canada, the same 28-day supply costs $389. Some life-saving drugs have been associated with price gouging schemes. Between 2007 and 2016, the price of an EpiPen 2-pack rose from around $94 to over $600, a more than 500% increase. despite no significant changes to the product. Mylan, the manufacturer, was at the center of the controversy, accused of exploiting its dominant market share for epinephrine auto-injectors. The public and political backlash was swift, with widespread outrage from patients, advocacy groups, and politicians. In response, Mylan introduced an authorized generic version of the EpiPen in 2016, priced at around $300 for a 2-pack. Other generic alternatives have since entered the market, providing some relief for customers. The solutions to dealing with the problems of the American healthcare system are multifaceted and possibly unattainable. The big problem is greed. Capitalism can work, but sometimes investors and executives go too far in maximizing profits while not delivering results to the consumer. And when it comes to healthcare decisions, this can be incredibly dangerous in that people who need a claim approved for an important operation or pre-existing condition can die if denied. There is a constant debate about whether healthcare is a right or a privilege. Doctors follow the Hippocratic Oath, whereas they are sworn to treat any individual regardless of insurance status, and hospitals must do the same under the Emergency Medical Treatment and Active Labor Act of 1986. But if an individual is uninsured or underinsured and they're stabilized, the hospital and insurance companies can say they're not covering the cost of staying extra days, which can persuade the patient to leave the hospital. In addition, this can put the patient's life at risk if there is an underlying condition that is unresolved. This scenario proves that in the United States, health insurance companies are in charge and can decide the patient's fate, and many health insurers prioritize profits over health. All corporations are in business to make money, but health insurers are in an industry that can make the difference between life and death. So, insurers should be more compassionate when they're deciding to approve or deny a claim. Instead, these companies continually charge high premiums, deny millions of claims, and try to make as much money as they possibly can, lining the pockets of executives with millions and millions of dollars. This will likely continue, so what should happen is more governmental regulation. All other developed nations have stricter rules put into place to monitor healthcare and pharmaceuticals. If this were to happen, healthcare for Americans will become more efficient and consumer-oriented. Of course, there is a huge barrier to regulation: lobbying. Healthcare insurance companies and big pharma have huge lobbying powers and use them to persuade Washington politicians to favor their motivations. Many of these politicians are in with the lobbyists and are persuaded to favor them over their voter base. Another solution is associated with healthcare fraud. Healthcare fraud is a serious problem in America, costing billions of dollars each year. It can take many forms, such as billing for services not rendered, submitting false claims, or stealing patient information. These crimes not only hurt taxpayers, but also can promise the quality of care for patients. Enforcement of fraud should be swift, and these scammers should be arrested and given stiff penalties. If proactive solutions are implemented, then the United States healthcare system can become more capable, thus improving the health of Americans. The American healthcare system is incredibly complex and confusing to navigate. While there are many problems with it, not all are bad. The United States has a significant number of world-renowned hospitals, often ranking in the top of the global list. Institutions like the Mayo Clinic, Cleveland Clinic, and Johns Hopkins Hospital are recognized for their advanced medical research, cutting-edge treatments, and highly skilled medical professionals. And many people from around the world come to the United States for life-saving operations. However, there are disparities, and usually the wealthier people benefit from going to these institutions for care, while normal Americans are not given the same benefit. Overall, the American healthcare system is riddled with systemic issues. High cost, unequal access, and bureaucratic inefficiencies plague the system. To truly address these challenges, a fundamental shift in priorities is necessary. This could involve increased government regulation, stricter oversight of insurance companies and pharmaceutical industries, and a greater emphasis on preventive care. Ultimately, the goal should be to provide quality, affordable health care for all Americans, regardless of their socioeconomic status. What do you think can be done about improving America's healthcare system? I'd love to hear your opinion on the matter, so please leave your feedback in the comments section below. That concludes this week's episode. Thank you so much for watching. I hope you enjoyed it, and if you like geography, both physical and human geography, you'll love the content on this channel. So be sure to subscribe to my channel, Our World, Our Planet, Our Home, to view more videos. Until next time!